Good afternoon, everyone, and welcome to the latest instalment in the New South Wales NGO Researchers Forum for 2023. I'll start by acknowledging that we are meeting on the traditional lands of, for me, it is for the Gadigal people, and pay our respects to elders past, present and emerging, and ensure that we acknowledge the rich cultures, customs and continued survival of First Nations people on Gadigal country, and indeed on the many First Nations lands and waters across New South Wales. My name is Ben McAlpine. I am the Director of Policy and Advocacy here at NCOSS. It's a real pleasure to be hosting today and bringing you all on a little journey of what we've organised. And I will start by thanking Rosalita for all of the hard work that goes behind the scenes in organising each of these. Thank you, Rosalita. A bit of background for maybe some new joiners. The NGO Research Forum was initially started in 2008 by Mission Australia and the Benevolent Society, and it was a loose gathering of NGO orgs as well as some stakeholders that wanted to come together and share information around research and evidence. It was relaunched in March of last year, and so the forum was slightly invigorated, and what the group really wanted to focus on were areas around grey research, presenting good practice examples, and to try to build up the capability of the sector. Agenda for today. We're really excited and lucky to have a very interesting group of people, as we always do, but obviously today is extra interesting, and I'm sure I would say that at each one of these. Big thanks to Robert, Neha, Katie and Anusha for all of the work that you've put into preparing for today, and obviously sharing your research with us as we go through the session. A friendly reminder to our presenters and to all of you, we've allocated about 20 minutes for each speaker, a little bit of flex depending on how we go, but then we'll do questions at the end as a group to discuss takeaways of individual items. So please, if you can, hold off on any questions, put them in the chat if you like to, and then we'll get to that at the end. And as always, we'll have a bit of a information sharing as well. So if there's anything else that people want to share, feel free to share at that time. Always a really useful moment to hear what else is going on in the sector. So to kick us off, we have Rob Stirling, CEO of the Network of Alcohol and Other Drugs Agencies, NADA. NADA is the peak organisation for the non-government alcohol and other drugs sector in New South Wales, and it represents 80 organisational members that provide services in over 100 locations across New South Wales. Rob himself has been in the AOD sector for over 15 years across government and NGO sectors, and we're really looking forward to this incredibly important and what I would imagine be a very challenging task of trying to come up with a core set of performance measures across the sector. So Rob, thank you for your time today, and I'll hand over to you.
Thanks so much, Ben. Appreciate it. I'll just share my screen. Can you all see that?
Yes, we can.
Perfect.
At least I can.
Great. I'll assume that everyone can. Thank you so much. I really appreciate the opportunity to share this body of work that's taken up much of my life over the past 5 years. So the intention... So someone has...
No, keep going, Rob. That's been rectified.
Great, thanks. So the purpose of the research that I undertook was to reach consensus on a core set of KPIs, essentially, for use in contracts by funders for New South Wales non-government services. As I'm sure many of you can appreciate, NGOs are subject to a range of accountability measures, and it's created a significant burden on NGOs, and it's been subject of a productivity commission back in 2010. However, we were still in a place where we really felt that we weren't measuring what matters, and concerns around how that data was used or not being used by funders as well. So essentially what we want to do is make it more meaningful for service users, for providers and funders. I'd also like to acknowledge the traditional custodians of the lands. I'm also meeting on beautiful Gadigal land today, and acknowledge that much of this work has been undertaken on Gadigal land also. And I just also want to note that almost a quarter of all episodes of care for New South Wales NGO drug and alcohol services are delivered to Aboriginal and Torres Strait Islander people. So it was really important for me as part of this research to ensure that Aboriginal people informed both the design and delivery of this research. And so I undertook ethics through the Aboriginal Health and Medical Research Council, and Aboriginal people were engaged in all phases of the research. And these are some quotes from Aboriginal service users when they were talking about what supported meaningful outcomes for them within drug and alcohol services. I'd also like to acknowledge people with living and lived experience and the important role that they play in shaping policy, practice and research, and engaging people with living and lived experience was also another critical component of this research and often missed out when we talk about things like performance measurement, assuming that people either don't understand or aren't interested in being involved in what that means. Just some other acknowledgements. We received funding by both the Australian Government Department of Health and Aged Care as well as the New South Wales Ministry. And I just wanted to do a bit of a shout out. So this work was undertaken through a scholarship as part of the Doctorate of Public Health program at UNSW, which is a professional doctorate program. It enabled me to do this research in practice, in real world, and I highly recommend it. Professional doctorates as a means for our sector to drive research. And with that, I just want to acknowledge my board and members, as well as all those funders and policymakers for supporting me to undertake this work, because without their buy-in, it would not have been possible. I'd like to acknowledge my academic supervisors, Alison Ritter and Sally Nathan from UNSW, as well as all the participants that contributed. So Ben mentioned we're the peak for New South Wales. We represent drug and alcohol services, and they provide a range, our members provide a range of services across a continuum of care. But I've just highlighted treatment because actually this research has just been focused on those services that are providing treatment. But what I think is important to acknowledge is that our members are pretty diverse in their structure and philosophy and approach, from harm reduction services through to abstinence-based, faith-based services as well. So that added to the complexities of trying to reach consensus on a core set of measures. And herein lies why I undertook this research. So you can see in the centre is New South Wales non-government services, and all of those places are where funding comes from. So it's a really complex structure, and I'm sure everyone online is familiar within their own services or even within government and research about the challenges. So the scope of this didn't include non-health related funders. So DCJ KPIs weren't included, but primary health networks were, client contributions and other things, fundraising wasn't included in terms of those measures. We were specifically looking at measures used in funding contracts with health funded providers. So this is the methodology. I'm not going to bore people too much with the methodology, but I'm really happy to talk to people. I'm going to step you through each of the phases in a moment, so I won't spend too much time on this, but essentially we did a review of all the existing measures within contracts against best practice. We held focus groups with those groups that I spoke about before, service users, treatment providers and funders, to understand what they thought was important and to see whether there was any agreement or disagreement. And we also wanted to understand what were the challenges associated with implementing performance measures. And finally, we did a Delphi process, which was a consensus reaching process to reach agreement on a core set of measures. And here's a nice comment from one of our members from one of the services. Who is the expert? Because government's telling us they'd like us to deliver the service, but also framing it that we need to have a client-focused service, and it can't be client-focused if the government's telling us what the outcome has to be. And that really goes to what I was trying to achieve through this research, was to make sure that it was really collaborative and making sure that all end users were involved in decision-making. I'm not going to go through all of this, and I guess these are the different measurement types that we used, and there's what it measures and the example KPIs. And I think what's important to take away from this is we often hear from government that we're moving to outcomes-based funding and commissioning, but outcomes are only part of what we need. Yes, outcomes are super important, but to create a picture of performance and accountability of public funds, you actually need to look at a range of measurement types to assess performance of an organisation. And also acknowledge that often the outcome tools that are used by our services have been developed and validated for clinical use. And so the complications of then how do we aggregate that data and make it meaningful for funders to assess performance as well. So phase 1 results we assessed against these criteria, and that's from the Australian Health Performance Framework, have some features of good measures. And so essentially I asked all of our NGOs and all of our funders to give me all the KPIs that they have in contracts, and I received over 1,000. When I deduplicated it, there were 537. But you can see here, so it was essentially me, a funder representative, and someone from my board assessed 537 measures on a 5-point Likert scale. And on average, you can see that the majority of the measures are not best practice, and they didn't rate well across these criteria. I think the most interesting part, obviously the 537 number is huge and unnecessary, but you can see here when we look at the total number of measures, what we're looking at is measuring outputs. So we're counting things. How many sessions have you run? How many groups are you running? How many people did you have in a bed? Rather than what's particularly meaningful when we talk about moving to outcomes, actually less than 10% were actually measuring an outcome. So what did service users, providers and funders think is important? So I did 10 focus groups, 5 with service users, 4 with treatment services, and 1 with funder groups. So the majority of voices that we heard were from service users and from providers. And you can see there in the Zoom, unfortunately, COVID lockdown hit just after I did the Aboriginal Community Control treatment services. And so the rest were done via Zoom. So this is just a bit of a picture. This was the focus group for the Aboriginal women that we held in Redfern at Tribal Warrior. And just to give you a flavour of what the focus groups look like. So we had all the different measurement types around the room. And to start off, we unpacked what the different measurement types meant. And we asked participants, in a democracy process, to go up and put sticky dots next to the type of measurement types that they thought were important to assess performance of drug and alcohol services. And so what we found was that what we talked about in phase 1, where you can see over there that the majority were output, followed by process and structural. Actually, what we're measuring is exactly not what we should be measuring, what's important to all those groups, including funders. So you can see that access measurement ranked in number 1 overall, followed by experience measures and outcome measures. Actually, when you look at the bottom table on table 5 down the bottom, there were differences amongst service users, treatment providers and funders. So access measurement was number 1 for service users because you may not be aware, but most people can't get into drug and alcohol treatment. So there's extensive waiting lists. So I think it's really disappointing that when you ask service users what's the most important thing to achieve positive outcomes, it's actually getting into a service. So I think that's something that we certainly are impressing to our funders. That's something that needs to be addressed. And so unsurprising, outcomes and experience were voted most important across treatment providers and funders. So then there's a lot of qualitative data, and I don't have a lot of time, but this is where the richness of the data really came into my study and where I enjoyed it the most, because hearing the voices of people was really important. So once we understood what was most important, that's where we spent the most time unpacking, well, what do we need to measure? So these are the themes that came across against each of the measurement types. And I've just got some quotes against each of those. So obviously we spent a lot of time on access measurement, particularly with service users, and experience and outcome measures. And so essentially what I then had to do was to take the information from the themes and try to put that into KPIs, or try and come up with KPIs that responded to what was really important to people. And some of those are really challenging. Obviously, therapeutic alliance, you can see under experience measurement, is a really challenging thing to put into a KPI. And the last one there, we have to accept that not everyone's going to have an abstinence-based outcome. And that was a real fear from our treatment provider services, that government are wanting abstinence to be the outcome of alcohol and other drug treatment. And we know that for people accessing services, that may not be what they're wanting to achieve. It might be to reduce their use or to reduce the risks associated with their substance use. But thankfully, it wasn't actually something that funders said was important. It was more about reduction of alcohol and other drug use or risk behaviours. We didn't talk as much about structural measurement, process measurement, input and output, which is which the bottom three certainly is good, but from structural measurement, that was really important, particularly for Aboriginal people, because when we talk about the workforce, having Aboriginal people was really important to supporting positive outcomes of treatment for Aboriginal people. And interestingly, what was important across all service user groups was the importance of having lived experience workers as part of the workforce characteristics. So what did service user providers and funders think was most important to measures in contracts? So as I said, I took all of the qualitative data and distilled that into what was 93 suggested KPIs in round one. And I'm not going to spend too much time on this slide. I think the most important thing to take away is that there was equal decision making. So there were 10 funders, 10 treatment providers, and 10 people with lived experience who were the panel that were reaching consensus on what they thought were important. And so we ended up reaching consensus on 17 measures overall. And I just want to pick up that we separated system level measures from service level. And what that means is that it was around the access measurement. Service providers felt very uncomfortable that they would be assessed against things like wait time because they're things out of their control. Of course, all NGOs want to be able to provide suitable access to everyone who needs this treatment and support, but that's not something that they're able to do. So to alleviate that anxiety, we separated system level measures from service level measures. So what did we land? So we landed on 2 system level measures that were relating to access, which was around the number of people who are eligible and suitable that couldn't be accepted into treatment for capacity issues. And this is really to be used to drive our advocacy and policy to say that actually we could have treated or supported these people, but we actually didn't have capacity. And then average wait time was another KPI that was agreed. So here's a big slide. Here are the service level measures that reach consensus. And so you can see 4 are in bold. And they're in bold because they actually reach consensus really on. So there was three stages before you reach consensus. So there were 3 online surveys before we reached consensus. And so audited financial statement, accreditation, and then the other one around the minimum data set, it was really unsurprising that we reached consensus really early. And we debated about whether we would even include these because they're compliance measures, and that government were never going to say, no, you don't need to do that. So it's not surprising that they reached consensus quite quickly, but really positive that the number and percentage of staff trained in Aboriginal cultural competence reached consensus really quickly, that everyone thought that that was something that was really important. The actual expenditure against budget one in input's actually been removed. So we've gone through a process at the moment, which I'll talk about later in terms of developing specifications for each of these KPIs. And we made an agreement to delete that one because we thought it was replicating the audited financial statements and it was unnecessary. Also because some funders had their own templates that they make NGOs use, so it was a bit difficult to develop a specification. So you'll notice that outcome measures feature are a big focus, so that's really positive. And I should also say that NADA has an online data system for its members, which about 10 years ago, we developed a client outcome management system for our members. And we went through a process 10 years ago of deciding on what validated tools we will include. And actually all of those outcomes, except for the risk reduction, the risk behaviours one, and the treatment goals is already included in an online database. It's not a mandatory database for people to use. Some services use different validated tools as part of the work that they're doing as well. And really positive that we had 2 experience measures there around cultural safety. And the bottom one was a bit of a tricky one around the person's experience of being linked up with services after they leave a program. And this was really going to funders wanting to know that people were receiving some type of support. It was a challenging one because most services aren't funded to provide post-treatment care. And so this is how we got around looking at the experience of the person and whether they feel that they're going to be supported after they leave a program. How am I going for time? Okay, I've got a few more minutes. So I talked about the challenges with implementation. I'm not going to go through all of these, but essentially what we did is these were part of the focus groups. And you can see this comment down the bottom. We're in this because we love the people, we don't love the data, so it's hard. And that really goes to, again, the rationale for doing this study. We have our services, our NGOs are not funded to do performance measurement, and increasingly government is asking for a lot, and we're not funded to do it. We're funded to deliver frontline services, and sometimes funding might be to just add in a social worker or a nurse to an existing program without thinking about what that means in terms of reporting, and of course you can't separate an outcome for a nurse coming in as well. So a lot of this has been around educating funders, but what it does is give us what it has done in my thesis is give us a bit of a roadmap to look at how we can address some of the challenges with implementation around collection, utilization, interpreting, and systems that support data collection as well. So my thesis had 6 recommendations, and the first one is around the development of a national AOD performance framework. I showed you that first graph, which had all the different funding sources. And the reason, as a New South Wales peak, it seems a bit strange to ask for a national one, and it's because of the federal funding. Because if we can't influence the feds to really take some leadership and to do a collaborative process with the sector. It's really difficult for us to influence 10 PHNs in New South Wales who may add in different KPIs. So this is our way of saying, actually, we need a national approach to developing a performance framework. The next one around measure specifications, we're in the process of doing that now. The third one, all funders to include this core set of measures. We just had the Commonwealth include the KPIs in the activity work plans for all of their funded services from 1 July. It's optional at the moment, it's not mandatory. And services have basically been said in the template that we worked with the Commonwealth on is, if you're not already collecting this data, don't include it, suggest something else by way of testing them at the Commonwealth. And New South Wales Health has already indicated that they are supportive of including the core set when they come to reviewing their contracts. Of course, there are a core set, so we absolutely need to have specific indicators developed by Aboriginal people for Aboriginal services as well. And we've been working with some of our specialist women's services who have children in their care, as well as what some supplementary measures might look like for some of our specialist services. And then finally, we need some governance to look at monitoring of performance and further research, of course. In terms of the next steps, not really next steps, but I think for me, I did this as part of the DRPH program, and I'm the CEO. So it really was a lot of engagement with members to say, this was done as part of research. Do you agree with where we've landed? Do we need to do something different in NADA's advocacy? And so you can see there was the inclusion of a mental health outcome. So the number and percentage of people that report an improvement in mental health miss out on reaching consensus by 1% in the Delphi process. So I've got 69%, 70% was the cutoff. So actually we're advocating to include improvement in mental health as part of that KPI set. And I think I've already mentioned the other 2. So are we measuring what matters? I think we're moving towards that. And I think really what has supported this process so far is really the buy-in from everyone who knows that this is an issue. They want to make it, want to make a difference. I think it's going to be a while yet before we see the benefit of getting this core set. And I think it's not the end. I think once we've got like a year's worth of KPI data, it'll be a process of our services sitting down with funders. So we're interpreting the data in the same way and thinking what that looks like. We're of course concerned about things like benchmarking. Our specialist women's services even may have different eligibility criteria. So we're wanting to be really cautious to make sure that funders aren't looking at one service comparing to another and saying, well, you're performing better, because there's many variables that might impact on the service delivery of an organisation. There's some references. There's a position paper that I've developed which kind of provides a more user-friendly overview of the research, which I'll pop the link to in the chat. And it's really what we're using in our advocacy, but good to have a strong, peer-reviewed publications to support our advocacy as well. So we'll save questions for the end, but thank you very much for listening.
Thank you so much, Rob. Obviously, we're going to wait for questions, but even just the sheer number of measures, over 500, is kind of mind-blowing. And particularly that mismatch between what service users prioritised as opposed to providers and funders, I found really interesting and unsurprising. but a critical element of the process. It looks like a fantastic piece of work. So thank you very much for sharing. We will now move on to our next presenter, if I can get this working. So pretty much pleased to introduce a valued member of my own team, Neha Shah. Neha leads our policy work in areas such as children, young people and families, income support and financial inclusion. And one of the biggest pieces of work that Neha leads is this major piece of research every year around the cost of living in New South Wales. Prior to joining NCOSS, Neha lived in New York, where she worked in international development, leading the social impact work for a global advocacy organisation, and now also has a master's degree in public policy and management. So over to you, Neha, to walk us through this research.
Hi, everyone. I'm gonna just share. Hi, everyone. Today, I'll be sharing the findings from the cost of living research that we do annually. The report was launched 2 weeks ago and was conducted by the Institute of Public Policy and Governance at UTS. It provides a snapshot of household budget priorities, expenditure on essential goods and services, and the extent of financial stress and hardship being experienced by different demographic groups and locations around New South Wales. It serves to highlight areas of need and bring forward the experiences of people living in poverty or on low incomes. It serves as a critical part of NCOSS's ongoing advocacy, and I'll talk about how it informs our policy work at the end. So we wanted to start with this quote from the research, as it captures so many elements that are key things that have come through. It shows the full extent of the struggle that low-income households are facing and how much worse it has been since last year. In almost every comparable area of this year's study, we can see that rising living costs had worsened outcomes for people living on low incomes. Housing affordability is a core issue, both in terms of housing stress and also the repercussions it has through the rest of a household's budget. There are few, if any, budgetary cuts left to make. And more people are taking last resort measures to cover costs like skipping meals, medication, and healthcare. More people are using buy now, pay later and decimating their meager savings that they already had. And it's the anguish and distress that comes through so strongly from some of the qualitative data. People are barely hanging on. The 2023 study is comprised of quantitative and qualitative stages in the form of an online survey, focus groups, and in-depth interviews. This representative survey canvassed the opinions and experiences of 1,134 people living on low incomes or below the poverty line across New South Wales. The income of participants was calculated after tax and housing costs. This year, we also wanted to shine a spotlight on the cost of living challenges faced by multicultural communities. The survey was available in Arabic and Vietnamese, and a focus group was held with Arabic speakers. Before going on to the findings, I wanted to share some of the limitations relevant, which have not impacted the overall rigor or validity of the study, but are worth noting. All data collection for the survey was conducted online and required participants to have access to an internet-connected device, as well as to be computer literate. So it's likely to have excluded participants that don't have that access. The survey was conducted in English, Vietnamese, and Arabic, and therefore potentially excluded any participants who were not fluent in one of those languages. The sample size of individual language or cultural groups was not large enough to analyse. We also want to acknowledge that we use the term culturally and linguistically diverse throughout the research. This term can unintentionally merge diverse communities and overlook the distinct experiences, needs, and challenges within these groups. While we tried to keep the survey questions consistent with last year's, there were some wording changes that needed to be made. We also needed to introduce some new questions and categories. Therefore, we're not able to draw year-on-year comparisons for all questions. This is the biggest one. Since the research was completed in mid-May, we have seen additional interest rate increases, and therefore the situation is likely worse for most of these households. So a big element to this story centres on housing affordability. Among those paying housing costs, the majority, about 69%, are experiencing housing stress. And housing stress is people who are spending 30% or more of their household income on housing costs. This is up from 60% in 2022. 29% are experiencing extreme housing stress, and that's spending more than 50% of your household income. And we saw the extreme housing stress having a much greater impact on those living below the poverty line. We also found that 1 in 5 people had been unable to pay their housing costs on time at least once in the last 12 months. So housing affordability impacted different groups. Private renters were most significantly impacted by housing stress. This had increased to 79% from 73% in the previous year. 1 in 3 renters are also experiencing extreme housing stress. Just under 2/3 of mortgage payers are in housing stress. Far greater housing affordability has had a far greater impact on single parent and single adult households. 81% of single parent households and 76% of single adult households were experiencing housing stress. 1 in 3 households in Greater Sydney were in extreme housing stress, and that was compared to less than 1/4 in regional New South Wales. 14% of the respondents reported moving house due to the cost. This was significantly more common amongst culturally and linguistically diverse households. 1 in 10 reported moving in with family or friends due to cost. 5% of respondents reported experiencing a period of homelessness in the last 12 months, and this was more common among First Nations people, single parents, and people under 25. Two out of 3 renters also reported experiencing a rent increase in the last 12 months. 13% had a rental lease terminated or not renewed by their landlord, and this disproportionately impacted renters with disability and renters aged between 25 and 34 years. In terms of employment, almost 2/3 of our sample were employed. Again, this demonstrates that this is not just about people on income support, but with it's about households with potentially multiple jobs. The proportion of people with multiple jobs was consistent with 2022. However, we saw this was more common amongst culturally and linguistically diverse participants. There was a small increase in the percentage of people working over 40 hours a week, and this was more common among men than women. We found that there was a significant disconnect between pay and the cost of pay rises and cost of living increases. The majority of people currently employed have not received a pay rise in the past 12 months. Among the 45% who have received a pay rise, only 9% say that that amount they had received had covered their increases to their cost of living. Men were more likely to have sought and gained a pay rise than women. They were also more likely to have received a pay rise that covered the increase of their living costs. Workers in regional New South Wales were significantly less likely to have received a pay rise that covers the increase to their living costs. And this was compared to Southwest Sydney, Western Sydney, and the rest of Sydney. Approximately 1 in 10 of the sample reported experiencing difficulty accessing government support. There were some significant variations at the demographic level. 25 to 34-year-olds, households with disability, and single parent households were among these groups. There were some common challenges that people emphasised around accessing support. These included eligibility issues. In particular, this was raised by new migrants. Participants also reported difficulty finding useful programs, administrative difficulties, and delays, which left them for periods without income. For example, one participant had been told that the documentation that they uploaded was blurry, but they were only told that once they rang up to ask about why they hadn't received payments. This particular person was left without income for a period of 2 months. Many of the respondents who received government support payments stated that the support that they received was insufficient and not keeping pace with the rise of cost of living. We saw increases in the number of people experiencing financial hardship across all areas as a result of increasing pressure from cost of living crisis. Almost half of the sample had been unable to make at least one essential payment in the last 12 months. Essential payments included payments for things like utilities, essential travel, mobile data, and internet, making minimum credit card payments and rental or mortgage payments. These instances of financial hardship disproportionately impacted First Nations people, single parents, households with disability, and carers, and individuals aged between 18 and 34, and people living in regional parts of New South Wales. I've put in a few of the quotes there that we've got from our focus groups, which really show how dire the situation is in terms of balancing the budget. An even larger proportion of our sample reported going with essentials, without essentials, such as personal care, services, prescribed medication and healthcare, meals, and essential hygiene items at least once in the past 12 months. Multiple parents reported skipping meals to ensure that their children were able to eat. We also saw that people were reducing the quality of the food that they were consuming to improve the affordability of their meals. In many cases, this was compromising their health. Many also reported that it was increasingly difficult to find GPs that bulk bill, leaving many in the position of holding out to seek healthcare only when urgent. Many participants also emphasised that the stress and anxiety of making these trade-offs and the associated impacts of their quality of life were having a substantial impact on their mental health. Almost 2/3 have sought some form of financial assistance in the past 12 months. Respondents were significantly more likely to seek financial assistance from friends and family, or use buy now, pay later services, or pawn or sell something in order to make ends meet. Many households reported being forced to draw from their savings to cover the rising cost of living. Almost 2/3 of the sample reported having no money set aside for emergency. This was up from 58% in 2022. Having no funds set aside were more common among single parents compared to couples with dependent children, households with a disability or with a carer compared to those without, 55 to 64-year-olds compared to those in the other age groups, renters compared to those living in their own home, and women compared to men. Now, we acknowledge that there's a lot to do and there's no quick solution to fix the current crisis. However, NCOSS has put forward a list of recommendations for the New South Wales government to highlight the levers it can pull to address the impacts on low-income households. These recommendations build on the qualitative data that we found from the survey, as well as the quantitative data, and a number of consultations that we conducted with our members. The recommendations are divided into 3 themes. The first being responding to the housing crisis through social housing investment and improved conditions and protections for renters. This is making sure that there's social housing that address unmet needs and target those groups at greatest risk of homelessness. Renters, making sure that there's more protections for them around no grounds evictions, limits on rental increases, and the minimum standards for rental properties. The second theme was around alleviating the extreme impacts for the crisis through targeted support measures. Some of these measures are improving the awareness and uptake of the government's cost of living initiatives, compensating community organisations who are playing a key role in supporting their clients in accessing these schemes, extending public transport concessions to groups currently excluded, and an overhaul of the current system of food relief to ensure that it can cope with the rising demand, developing clear roles and responsibilities for all involved parties, and ensuring better coordination at a local level. The third theme was around strengthening the foundations of the social services sector as rising demand, more complex demand, and our groups have not sought help before, as they're seeing all these groups that have not sought help before. And this is through evidence-based approach to indexation, core funding for neighbourhood centres, enhancing capacity of essential programs who are overwhelmed by demand, and that's financial counselling, tenants advice services, mental health supports, and Justice Connect's pro bono legal services who play a key role in helping organisations on the ground with the legal work that they need. So I think we'll probably come under time, but if anyone had any more questions, I've got my contact details there should you need it.
Thank you, Neha, and I'm sure there may well be questions at the end. Our final presentation is from Dr. Kathleen Blair and Anusha Muller from UTS. So a little bit of background about our two presenters. So Katie began her career as a research assistant at Western Sydney University. We were talking just before we began that she has also previously worked at DCJ, and she's particularly passionate about ensuring that research is accessible and easy for practitioners to understand, so that we can inform program and service design, which is exactly a core part of what we're trying to achieve here. Anusha has extensive experience in the human rights and social justice sector, and she's worked in roles across media, campaigning, project management. She began her career working for Lord Mayor Clover Moore, where she focused on advocating for social housing. And since then, she's worked as a climate campaigner for Get Up and at the Australian Human Rights Commission. So thank you to both of you for joining us today, and I'll hand over to you to take us from here.
Thanks for that, Ben. It's always funny to hear yourself introduced. I'm just going to share my screen. Give me 2 seconds. Amazing. Can everyone see the
Yes, that looks good.
Yeah.
That's
amazing,
good.
great. It's always hard on Zoom, you can't probably see yourself. So welcome everyone. I would like to start by acknowledging the country that I'm on today. I'm presenting to you from UTS, which means I'm also of the lands of the Gadigal people of the Eora Nation, and I would just really like to kind of recognise being on a university campus to recognise the long histories of learning and culture and tradition that has always existed in the First Nations communities, that has not always been acknowledged by our kind of traditional university sectors, but to really kind of highlight that and acknowledge that, and to show you this kind of beautiful photo of all the Aboriginal languages that kind of exists across our very large and wonderful state, and also the ACT as well. So yeah, as Ben introduced us, we're here from UTS today. We work in the Centre for Social Justice here at UTS. I'm a social impact practitioner within the research and evaluation team. And Katie, do you want to give yourself a quick introduction?
Yeah, so hi everyone, I'm Katie. I'm the Research and Evaluation Manager in the Centre for Social Justice and Inclusion. I would also just like to acknowledge that I'm also on Gadigal land today, and that this land is unceded and always was and always will be Aboriginal land.
Great, thanks for that, Katie. So just give a very quick overview. This is the agenda of everything we'll talk through today, but just to kind of highlight that we're here to talk to you today about a grants program that the kind of centre runs. And so while this is an internal program that we'll be presenting to you, one of the key features of this program is that any UTS staff member or student that applies for the grant has to be linked with an external organisation. So whether that's a government organisation, industry peak body, community organisation, but that is one of the key features of the grant. So the reason we're here is to kind of talk you through the kind of grants and why we're doing this, and see if there'd be really any interest from kind of anyone on this call or any members to kind of work with UTS to apply for such grant. So here's today's agenda. Like I say, we'll go through everything and everything will make sense as I kind of go through. So I guess before we kind of kick off really into talking about what the grants are and how it could help any of the organizations, I guess, on the kind of call, I guess just to kind of really give some context as to what we're talking about when we talk about, you know, why UTS is kind of in this space and social impact. And I'll go through the words engaged scholarship as well. And I guess to just really set the context that, you know, as at UTS, you know, we really do believe that we are a public purpose institution as a university, and we really do kind of want to have social justice at our core. And by social impact, you know, we're really talking about that kind of significant change for individuals, communities, or environment that kind of result in enhanced equity, inclusion, you know, a lot of the things that obviously people on the call will be familiar with. But I guess at UTS, something to really kind of give the context as to why we're kind of here and doing this kind of social justice work and where that link kind of sits is that we really think that universities have a responsibility to contribute to society and really to contribute to the kind of communities that we serve, and also to really work in tandem with those communities. And the kind of picture I have up on the screen here is what we call our social impact framework, which is essentially a fancy way to say it's our framework and strategy to help us achieve kind of our social justice agenda. And so I guess, you know, what we're seeing up on the screen here is really us as a university saying, hey, we really do want to have social impact at our core. We want to kind of use our really vast resources, power as an institution to kind of steer it towards social justice. And this is how we're going to do this. So I'm not going to go into this because I could probably, you know, do a whole presentation on this, but it's just to really kind of foreground for you that the university is really working towards a kind of social impact framework and agenda, and how that kind of ties into the grants program that we're going to run you through in a second. So the grants program really, I guess, came from the social impact framework and also the idea of engaged scholarship. And so engaged scholarship, I guess, really kind of comes from the idea that universities are obviously about delivering education, knowledge, teaching and research. But at the same time, rather than kind of undertaking that research and those projects just on behalf of the community, that actually we should be as universities working in collaboration with the communities that we seek to serve. And by doing so, that's actually where we kind of generate those meaningful, equitable and impactful outcomes. And instead of kind of having that really top-down approach, or, you know, kind of doing things on behalf of people, or, you know, simply handing over a report or a piece of research, that if you really do things kind of really integrated with community, co-led with the communities that you're working with, you just kind of lead to kind of outcomes and I guess ways of working as well that are just more kind of equitable, have bigger outcomes, and kind of really push that research, I guess, beyond the ivory towers of universities. Really place community partnerships at the center of the kind of dynamic, and as a kind of side note as well, kind of re-establish and re-explore those historically exclusive power dynamics. And as you know, we were talking, you know, presenters have been talking about before, you know, kind of really valuing that kind of lived experience, that local knowledge, perspective, and experience. So this is something that we as a centre are really passionate about. The university is also really working towards a framework of engaged scholarship. And there are lots of benefits to this. Not only do you kind of really have that community participation, that community trust, and that feeling of really ownership of projects, you also facilitate, again, that kind of grassroots, ground up change. You build capacity. And then again, for us as a university, you know, something where we have this kind of big framework and big kind of social justice agenda we're working towards, it really kind of enables us to be this kind of active, engaged, trustworthy member of our local community, and at the end of the day, fulfilling a public purpose, like I mentioned. So that was a whole bunch of stuff to kind of just situate where we are as a university. But out of the kind of framework really is where this kind of program of the UTS social impact grants came about. So they were established 6 years ago. And again, the purpose of them was to really, I guess, to create a funding resource or a funding pool to be able to enable UTS staff and students to go on to develop socially impactful projects, research or practice that could really kind of enable this socially impactful purpose we were trying to achieve. So the grants, there are 10 grants that are available every single year of up to $5,000. And again, one of the key features of the grants, while they are internal, so the grants are predominantly available to UTS staff and students, a key feature of the grants is that any UTS applicant must have an external partner. So that again can be government, industry, or community organisation and partners as well. And I guess they were really developed these grants as kind of a, again, collaborative mechanism to kind of enable research and practice in the social impact space and kind of support the UTS community to kind of move towards that kind of engaged scholarship for enhanced social impact, to kind of really build UTS kind of researchers and practices and practitioners' own capacity to work with the community, but to also develop better outcomes for community partners as well. So we have given out 65 grants so far since the program start, and then next year in 2024, when we will start up the grants program again, we'll have 10 grants of $5,000 to be awarded as well. So just some key information to kind of give you the main points about the grant. So any UTS staff member or student can apply. As I've mentioned, the reason it's relevant to kind of the people on this call or beyond is that the project must be a partnered project. It must have a partner that is external to UTS. To foreground though, that this relationship can be new and existing. So you might have been working with researchers before or have never worked with a researcher. Either one would be eligible for the grant. So, if it's a project that has been like going on for years and years and there's a certain part of the project you would apply for funding for, or if a project has just been a new or the relationship is new and you apply for it, you come together on an idea for a project and, would need kind of seed funding or funding for the kind of beginning of that project, both would be completely eligible under the program. Again, as I mentioned, the grants are $5,000 each and there's 10 available. But just to note that often UTS faculties will match the funding. So $10,000 is often kind of what the successful applicants end up with. And to, I guess, give some information on what we are looking for. As I mentioned before, a lot of this the kind of work that we're doing here at the Centre for Social Justice is focused on social impact and addressing social issues. So the grants are really looking for projects that kind of have considerable or real potential to address social issues. And this can be, across a wide range of things. The grants are open to all UTS staff. So, we often get grants relating to, engineering or health or, design, like any kind of social issue. But we do expect that projects will be partnered with an external partner or a community organisation. And this is a key part, we really kind of look for projects that can demonstrate that they've had really significant engagement with their partner to identify their partner's needs and designs, and also with the beneficiaries as well. So again, it's kind of moving beyond that traditional approach of researcher has an idea, goes out to the extracts from the community and then comes back. It's really about kind of having that really co-led, co-designed project together to both kind of really address whatever social issue it might be. And then in terms of kind of some requirements that we have, so the grants run from roughly about April to December, and then all funds kind of have to be spent by December. So they run for 1 calendar year. And then we do ask that all kind of recipients complete a project report at the end of their project to kind of talk about what their project achieved. And successful applicants also need to achieve a 1-day evaluation workshop as well. So just to very quickly run through some kind of ideas of or some kind of examples of previous successful grant partnerships, when we kind of talk about, UTS working with the community and working with other organizations, here are some examples of the screens. I won't run through them all, but here are some examples of kind of successful partnerships we've seen before as part of the grants program. So for example, we had for one of them, staff members from the Faculty of Law working with the HIV AIDS and Legal Centre to come up with a kind of guide for people who were migrating to Australia who were living with HIV, who actually face lots of extra legal barriers, discriminatory barriers, to kind of work on how to increase their chances for successful visa applications. And then we also had a grant of someone who is working with Lismore, so a kind of community organisation in Lismore, obviously faced a lot of flooding recently, is prone to kind of climate disasters that will happen in the future. And so they came up with a project together that was successful funding about kind of really building up their volunteer base and building that kind of disaster resilience within Australian communities that are going to be hit by future climate disasters as well. So they're just a couple of kind of, to kind of just create a bit of that understanding in your head of what we mean by kind of community, industry and government working with UTS to apply for these grants. And so at the end of the program as well, we kind of have a case study that's written from the project reports that people provide us. And we feature this on the kind of our big kind of UTS website for all the public to see. And it's just a really nice way to kind of, I guess, showcase the impact that these projects have. Obviously, $5,000 isn't a lot of money, but, you know, we often have recipients tell us that, you know, even though the amount of funding is small, it can really have, you know, a lot of impact, you know, depending on where the project kind of goes. Katie.
Thanks, Anisha. So as Anisha mentioned, the grants have been running since 2017. So we did think it was about time we did a bit of an evaluation of the benefits of the program and also what some of the challenges might be. We are still in the process of finalizing this, but there are some preliminary findings that we thought we would share today that really speak, I think, to the value of the program and also some areas of improvement that we've identified as well. So the evaluation focused on 3 key domains. The first was social impact. So we really wanted to understand what outcomes the funded projects had actually contributed to, what kind of impact they may have continued to have after their participation in the program ended. We also wanted to understand if the program was actually beneficial for grant recipients themselves. So did it actually support them to continue to undertake socially impactful projects? Did it improve their skills, their capacity, all those sorts of things? And then we also wanted to understand how we might actually improve our processes and our practices in administering the grants and implementing the program throughout the year. Can you go to the next slide for me? Thank you. So to do this, we collated all of the data that had been collected year on year as part of ongoing program implementation. So each year recipients need to submit a final report that details what they did and what the project achieved. There's also case studies, like Anisha mentioned, that are written up each year, and the case studies are written based on an interview with the project lead. So we're able to pull together all of that data. As you can see on the slide, there are some gaps in the data set. We weren't able to find reports for every year, and there were some case studies that were missing also, which is an unfortunate limitation of the research and kind of should be taken into consideration when interpreting the findings. But nonetheless, we were able to uncover some really interesting stories. Another thing that we did, so earlier this year, we did a bit of a follow-up survey with all of the past recipients to kind of, again, get a bit of an understanding of how their work had kind of progressed since they had received the funding for the grant. And as you can see, we only got 9 responses to that. So again, a bit of a limitation of this. But like I said, we were able to uncover some really interesting stories that kind of speak to the work undertaken and the impact of those funded projects ongoingly. So one of the key things that kind of kept coming up again and again when we were looking at all of that data that I mentioned was everyone kept talking about their partnerships and how the funding that they had received under the grants program had better enabled them to build collaborative and reciprocal partnerships with community. And then because of those partnerships, that the work that they were able to produce was of a better quality, it was more meaningful, it was more useful, and it was more sustainable. So there were stories that were told where UTS researchers and practitioners were saying that even 5 years on, people are still using the toolkit that they co-designed with community, or they're still working in partnership with that original organization, and the work has progressed from this tiny project that was funded with just $5,000 into a nationwide research project, and they now have government on board and a whole bunch of other really important stakeholders, or whatever it might have been. So there was a really clear sense that the model of the grants in which people need to work in partnership with community or with an external organization has really facilitated the generation of that longer term impact. There was a really broad range of positive social outcomes that were reported as part of the different projects that the grants have funded. On the slide are just a few examples to illustrate this, but projects did report improved outcomes for the intended beneficiaries of the projects. And this ranged from things like improved employment skills for refugee populations, enhanced outcomes for First Nations, enhanced health outcomes for First Nations communities, enhanced community resilience for bushfire-prone communities. The projects we fund are very diverse, and we obviously don't have a lot of time, enough time to go into all of them, but it was really incredible to see that a very small amount of funding was able to be used to contribute to positive social change like this. So one of the other things that we looked at was whether the program improved the capacity of successful recipients to undertake socially impactful projects. So one of the key things that we found was that the program has enhanced the capacity of participants to evaluate their projects. And this happened in 2 different ways. Some of the funding people received was actually used to evaluate programs or initiatives. And then from those evaluations, people were able to build their skills in that space, but they were also able to identify how to improve their programs or their initiatives. The other way that this happened was actually through the evaluation workshop that we run. So Anisha touched on this briefly earlier, that it is mandatory for all successful recipients to participate in an evaluation workshop. And through feedback on those workshops, we've found that they've really built the capability of grant recipients to understand why evaluation is important, to develop a theory of change, a program logic, how to map out their outcomes and indicators, how to identify what data that they need to actually be able to report against that and to demonstrate their impact, which was, so that was a really exciting finding as well, that the program is building those evaluation skills of the people who do participate. Some of the, back to the other slide quickly. Just some of the other things that we found taps into what I was talking about earlier, in that the model of the program in which UTS researchers and practitioners need to work in reciprocal partnership with community. This basically generates like a deeper understanding of community need. It facilitated a continued desire to continue working alongside community. And it also built the skills of researchers and practitioners to work in that way and to see the value of working in that way as well. So not only are we seeing like better projects being delivered, but we're also seeing the skills of of UTS researchers and staff to do that work in better ways as well. And then the last area that we kind of looked at, thank you, was around our program design. So we wanted to understand what sort of changes we need to make to how the program was run each year. Unsurprisingly, people did often mention that the funding does really limit the scope of their projects. It is only $5,000. Some years we are able to get faculties to match that, so that can increase the grant up to $10,000, but even that is still a relatively small amount. So it does mean that we do need to be really mindful of this when we're assessing projects and ensuring that they can actually be undertaken with the funding that's been given. Recipients also said that they wanted more opportunities to connect with other recipients, to talk about their projects, to connect, to potentially collaborate in the future. So we're currently looking into how we can better facilitate this. And then people also spoke about the tight timeframes for the program and how it is often quite difficult to ensure that the funding that they receive in May is spent by December. So we're currently looking into how we can bring that application process forward to give people more time to spend the funding that's received. Next slide, Anusha. Thank you. So on this slide, we do just have a handful of testimonials from grant recipients that really speak to the value of the program and what they got out of it. I've said a lot of this already, but it was really great to see that despite the funding limitations, people are able to get a lot out of a small grants program. They use the funding to kickstart initiatives, to build on existing programs or to evaluate them, like I was talking about before, to build relationships with community and to really contribute to that long-term positive social change that we're all working towards. So it was really great to see people recognize that. And then I think next one is, so as Anusha mentioned, the grants will be running again next year. We'll have 10 grants of $5,000 available. The grants will officially open in mid-February, and then applications tend to close around mid-April. We haven't got firm dates for that yet, but as soon as we do, it will be all of that information will be made available on our website. I will post a link to the website in the chat in a moment. But for anyone who is interested in applying, like Anusha was explaining, you will need to be partnered with a UTS staff member. So if you need any support connecting with someone, please reach out to us. You can see our email address on the slide. We're more than happy to have a chat about your needs and how we could kind of help connect you with someone across the university to co-design and co-deliver a project. And if you're interested also, we can add you to our mailing list so you can receive an email early next year with information about how to apply and the dates for when the grants open and all of that super fun stuff. So you can just email, again, that email address on the slide and we can add you to our mailing list. I think that's it. Thanks, guys.
Thank you so much, Katie and Anusha. Clear bit of interest and obviously a very important opportunity for people to try and get involved. So thank you for sharing. So I'm going to open it to the floor now. I looked through the chat. It looks like all of those questions that were raised have been answered, but please, if anyone has put a question into the chat that hasn't been answered, maybe Rob's question around how extensive is the reporting on the $5,000 grant. I think Katie did talk to that. So Rob, was that question answered?
Yeah, I mean, I think when I think about social impact, it just feels big. And so I was just thinking about 5K and, proportionality in terms of how much funds available versus how much reporting is involved. So yeah, I was just curious to understand what that requirement is.
The reporting is quite limited because we are very conscious of the fact that it is only $5,000 and we do need to temper our expectations as to how much time it takes people to do that. So it is quite basic in the sense that we do just ask people to describe what they did. We have a couple of questions around most significant change. There's a handful of Likert scale questions in there as well to kind of ascertain people's experience. There's it's normally, like, from what people have told us in the past, like, it takes only a couple of hours to complete. There are some people who go way above and beyond and who will include survey results from people who participated in their programs and all of those amazing things. But our expectations are quite tempered, I think. Yeah.
Yeah, look, it's a great initiative. Yeah, I was wondering part of the rationale was also thinking about the grants program in total from UTS and whether you have particular metrics that you need to answer to justify the funding back to the university, and whether there's particular things in social impact that you're wanting to standardize as part of the reporting to demonstrate the effectiveness of the grants program.
Yeah, so not at the moment. Like, the evaluation that we've done is largely qualitative, and we are relying on the stories that project leads have reported about the success of their programs. Because, again, like, it is such a small amount of funding, like, we can't actually expect people to do any more than that. We're in the process at the moment of figuring out how to grow the grants and how to figure out how we can actually award people more funding. But there is, like, a lot of advocacy work that we're having to do across the university to get people to see the value in this too, which is also why we've done, like, this initial evaluation. And then hopefully over time, like, if we are able to up the funding that people receive, then we might have, a bit of a more robust framework around that reporting. But at present, I don't think we can justify it because the grants are only $5,000.
And Katie, because they have to be aligned with partnership, and I thank you for answering my question on alumni members, whether there was any way of circumventing some of that process. I would take it that because you have to have a partner, that you might have the best project ever, but it may be that you can't actually get someone in the university to align with it as well. So you may lose that opportunity.
Yeah, that is the case. So we can't actually 100% guarantee that we'll be able to align you with someone. But there's no harm in reaching out and us just having a go and seeing, like, who we might be able to find across the university. Because the good thing too is that people don't just partner with academics. There's also a lot of professional staff across the university who are eligible to, and students are eligible as well. So if you were to be able to connect with an HDR student, for example, or a master's student, or even an undergraduate student who might be really interested, they could just find someone to supervise their project, and that would like meet our eligibility criteria.
And so do you find that alignment, or is it up to us? Because I'm just considering about trying to find that alignment. Whose responsibility is that? Like, I'm thinking of the old project where you could put up a project, and I've forgotten the name all of a sudden for many years, with that agency at the university, where you as an NGO wanted a project to be done and you'd put it up and then they'd canvass their undergrads to see if there were people available to do it. And sorry, I've totally forgotten the name of it. I'm just wondering, who does that alignment of your grant application to a project?
Yeah, so ultimately it will be your responsibility to find a partner, but we can support you. And there are some different mechanisms that we're testing out next year as a way to do that. So we're hopefully going to host a bit of a networking event to bring together community organizations or industry partners, whoever it may be, to connect with people across UTS to find a suitable or a potential partner. And we're actually also going to be trialing next year, Margaret, similar to what you've just mentioned, a bit of a dashboard where people can actually send us pictures of their projects and we can put them on the website, and we can share that routinely with everyone who might be interested, and they can use that as a way to see if there's someone who might be interested. Because what we find too is that it's not just community organizations who are looking for a partner, but sometimes it's UTS staff who are as well. So we're trying to find some ways that we can actually create the space for people to better connect with each other.
To break down the silos.
Yeah,
will this go out in Verity's newsletter, Verity First newsletter at all? Because I don't want to start over subscribing to different university newsletters plus my alumni stuff as well. So
yeah, we'll make sure that we tap into all the existing networks, because we don't want to have to create an entire newsletter and the entire new newsletter just for this. But yeah.
Thank you. And there was just one thing to clarify: deadline for 2024 grants.
Yeah,
mid-April, I said.
Yeah, so we haven't confirmed that. So just as a kind of overview, we haven't actually confirmed the exact timelines for next year because we are, like we said, trialing out some new things, like having a meet and greet for kind of community and UTS staff to come along. But in general, it probably will follow roughly the same timeline, which is that the applications open in February. We kind of used kind of February, March to kind of help people find each other, obviously give time people to write up their applications and apply. And then generally in about the middle to the end of April, we close the applications, we assess them. And then in the kind of around the early weeks of May, we notify applicants. And then they obviously get their funds, and then those funds need to be spent by December. So that's a rough timeline. And obviously once we figure out the exact timing and dates of everything, that's when we'll kind of update that website, which Rosalita very nicely put in the chat. That's where we'll update those timelines. And like we said, we'll also send out communications as well.
Fantastic, thank you. We now have a question for Rob from Rachel. Can you provide any further details on how you intend to address some of your ongoing implementation challenges, especially the future interpretation and utilization of the data, any strategies, change management processes required emerging? Rob, a simple question for you. What are you planning to do?
That's a big question and a very good question. And yes, there's multiple things that we're hoping to do to address some of the implementation challenges. So I think the first one is, well, now that we've reached consensus on a core set of measures, we can look at how we collect that data. And so that's what we're doing with an ongoing collaborative process with members and funders is around the specifications. So for example, the number of people that report a reduction or improvements in quality of life actually is probably a good one. So the specification will detail what data points we're going to be using as part of the KPI. I think government would like us to agree on one outcome tool, but unfortunately we're not there yet. So at the moment, the specification's listing a number of validated tools. So the PWI, for example, the World Health Organization 8-item quality of life scale, and there's an alcohol and other drug measure that has a single item on quality of life.
But remember, Rob, the PWI there's not a standard PWI because it's for different ages and different things as well. I think that people just say PWI and they think it's one document, but there's multiple types.
Yeah, and totally appreciate it. And I think, yes, it's not my job as a peak body to mandate a particular tool for our members. And so that puts me in a position where, yes, I'm a facilitator of this and trying to reach consistency. What I'm hearing loud and clear from my members is, yes, unless government's willing to say, we're going to link funding to a particular tool, we as NADA, as a peak, won't be doing that. But what we want to do is get to a place where we're as consistent as possible so we can support the reporting. And the question around interpretation is a challenging one. And so what I've suggested, I mentioned that the Commonwealth are including them in their activity work plans for our resi rehab services. So what I've done is I've emailed all of those services who are part of that group of funded services and said, hey, why don't, if you're going to include the KPIs, let's all get together so that we can work collaboratively around supporting the collection of the data, but then the interpretation of the data. And ideally what I'd like to do is to get those services and those funders in the room when we have the data and kind of talk about, well, what do you see as a contract manager? What do you think this data is telling you, so that we can have more of a collaborative discussion around interpreting data. And so it's a challenge. So the ongoing, it's an ongoing thing. And when I presented this to the Commonwealth and all of the jurisdictional health departments recently to try and get consistency, and I did mention to them that they haven't paid really paid anything for us to do this work. Like NADA has, I've done it as part of the scholarship. And so they need to invest the money in this. There's been a lot of goodwill and my board have let me do this work, but at some stage government need to phony up some dough to fund this initiative going forward as well. So that's something that we've been pushing. But in answer to your question, there's multiple things happening, and a lot of it is around continuing to keep those engagement of those funders and providers together.
It's interesting, Rob, because the osmosis that all these things just happen and they just invent themselves and they actually don't cost anything to put in, but they do, because they cost training, they cost time, they cost systems. And so I think that's a really realistic goal that you're taking. But I'm also interested in some of the measurement transferability into other services, other parts of the sector too. I'd probably like to have a conversation in the future with you.
Yeah, really happy to have a discussion. I hope that answered your question, Rachel. It's complex. And yes, I mean, the implementation chapter in my thesis talked a lot about those things, that when a funder changes a KPI in a contract, the flow-on implications on an organisation, systems don't pay for themselves because most people have their own CRM within a service. And so, yes, it's a big resource burden on NGOs that isn't included in contracts.
Yeah, thanks, Rob. Like Margaret, I wouldn't mind connecting with you.
Yeah,
around this.
Happy to. I'll chuck my email in the chat function as well.
Thank you.
Right, great. Now, there's a question for you. Are you hopeful or confident New South Wales government will respond to your findings and recommendations? I guess you could just pick either hopeful or confident.
Hopeful. I think we're in a very tricky political context at the moment. I think given that the budget, we're not seeing much hope or confidence that we're going to get increased funding in the budget. That's going to be coming up in September. But I'm hopeful that the current government is open to hearing these challenges. We've had good response from ministers about the report, and just how many intersectional issues are going to come up in the future because of the findings. So I think that I'm not hopeful something will happen in the next couple of months, but I definitely think we're seeing a lot of movement in the housing space. We're seeing movement, hopefully in the community services space and some targeted services. So I think it will get there, but just probably not this budget.
Neha, can I say to that, you're aligned, while it was a small survey in particular coals communities in a particular geography, I would actually say from what I'm hearing from neighbourhood centres that the cohort groups that you are coming in the door are the ones that are coming in generally across the area. We've particularly got, I hate the term working poor, but someone said to me the other day, that's what it is. And the private renters are really bad, but we're also starting to see that cohort of women that are middle-aged that haven't reached retirement that are coming in. But then someone also said to me, men who are in that group as well, but with mental health issues are the biggest ones we're seeing come through the door. So it actually does, I think, in real time, sort of iterate to what's happening out there.
Yeah, absolutely.
Might throw to either questions and or information sharing. So if someone's got a question, please feel free to ask, but we can also naturally start to swerve into information sharing. Is there anything that people want to share about what's happening, research, things that are coming up? Now's your opportunity.
Just a reflection. I mean, I was just thinking about Nia's, the NCOSS report. One of the things when we spoke to service users, one of the biggest things that they talked about that supported positive outcomes of treatment was being linked into housing, because actually a lot of people who come into drug and alcohol services have issues accessing housing. And it was a real challenge for me to try and bring that into a core KPI set, because it's really a big burden to place on drug and alcohol NGOs to support access to housing as well. So it's such a huge area of need that, you know, I think when you ask people their views on things, it's really hard to not give something back when you know the issues. I think it's a challenge that we face as NGOs and doing research as well, when we hear something that we can't fix and respond to.
I saw an announcement for the Centre for Western Sydney. They picked up funding for First Nations